Selective monoamine oxidase B, or MAO-B inhibitors, are one of 3 available monoamine oxidase inhibitors, or MAOIs. The other 2 are irreversible non-selective monoamine oxidase inhibitors and reversible inhibitors of monoamine oxidase A. If you want to learn more about these other 2 MAOIs, click the link on screen or in the description below. Selective MAO-B inhibitors inhibit monoamine oxidase B, or MAO-B. MAO-B are enzymes located in presynaptic nerve terminals, primarily within the central nervous system, and are responsible for activating the reabsorbed monoamine neurotransmitter dopamine. When inhibited by selective MAO-B inhibitors, less reabsorbed dopamine becomes inactive and instead accumulates in synaptic vesicles within the presynaptic neuron. When the neuron is next stimulated, this accumulated dopamine is released into the synaptic cleft, or the space between neighboring neurons, or a neuron and its target tissue, causing an influx. As a result, the effects of dopamine on its target are increased. Increased dopamine levels in the central nervous system improve mood and enhance alertness, focus, and motivation. Selective MAO-B inhibitors include Selegiline, Rasagiline, and Safinamide. Selective MAO-B inhibitors are primarily used either as monotherapy or in combination with carbidopa-levodopa to treat Parkinson's disease. In Parkinson's disease, increased dopamine levels in the brain can help improve motor symptoms. Selective MAO-B inhibitors, in particular the transdermal patch, can be used to treat specific depressive disorders. Adverse effects of selective MAO-B inhibitors include insomnia, orthostatic hypotension, but also hypertensive episodes, nausea, xerostomia or dry mouth, dizziness, constipation, and headaches. Selective MAO-B inhibitors should not be used with pheochromocytoma, an adrenal gland tumor that can cause dangerously high blood pressure. When receiving treatment with a selective MAO-B inhibitor, measuring blood pressure, pulse, and orthostatic vitals is essential. Measuring orthostatic vitals involves measuring blood pressure and pulse, first while lying down, and then again after standing for 1 to 2 minutes. If orthostatic hypotension is a concern, changing position slowly can minimize it. If this medication is prescribed for Parkinson's disease, improvements in motor symptoms, such as tremors, muscle weakness and rigidity, and ataxic gait, should additionally be monitored. However, if prescribed for depression, it is essential to assess mental status, including mood, anxiety, and suicidal tendencies, particularly in early therapy. Suicidal thoughts may intensify initially due to changes in neurotransmitter levels before the medication's full effects. If insomnia is an issue, taking this medication in the morning may help. Additionally, it is recommended to discontinue this medication for at least 2 weeks before undergoing general anesthesia when possible. At doses higher than recommended, selective MAO-B inhibitors lose their selectivity and begin to inhibit MAO-A enzymes. MAO-A enzymes are present in the liver and intestinal wall, where they are responsible for inactivating tyramine, an amino acid found in various foods. When MAO-A is inhibited, it cannot inactivate tyramine, leading to an increase in tyramine levels in the body. This is a concern because tyramine can trigger the release of norepinephrine, which can result in a hypertensive crisis, and a hypertensive crisis can lead to stroke or even death. However, to avoid the risk of a hypertensive crisis, the intake of tyramine-rich foods should be limited, regardless of the dose. Tyramine-rich foods include aged cheese, cured smoked or processed meats such as ham, fermented or pickled products such as soy sauce and pickled cucumbers, some alcoholic beverages, such as red wine and beer, yeast extracts such as Vegemite, and dried, citrus, tropical, or overripe fruit. Selective MAO-B inhibitors have many drug interactions. Therefore, it is crucial to consult a healthcare professional before taking any medications, including prescription drugs, over-the-counter products, and herbal supplements. Selective MAO-B inhibitors should not be used with serotonergic antidepressants, such as selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and some atypical antidepressants, as concurrent use increases the risk of serotonin syndrome. Additionally, they should not be used with sympathomimetic drugs, such as amphetamines, a central nervous system stimulant, norepinephrine, a vasopressor, and pseudoephedrine, a nasal decongestant, as it can lead to a hypertensive crisis. I hope you found this video helpful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!